Hi everyone, this is Jen Telford. I'm going to take you through my fitness education presentation for Kinesiology 562. So let's get going. First things first, we had 7 weeks working with an athlete or a client. Mine was a 37-year-old male. When I first meet with any clients at all, in my job even now, first things is a PAR Q&U that I fill out, as well as the ACSM guidelines for exercise testing and prescription. So I had my client fill both of those out, looking for anything cardiovascular disease, metabolic disease issues that I need to deal with, musculoskeletal issues that maybe he needs to get a referral for before he can actually start working with me, or anyone can start working with me. In this case, my client had no issues. No family history of heart issues. The only thing that he did mark yes to was a musculoskeletal issue, which I then assessed. We went through the functional movement screening, the FMS test. I did have a little bit of knowledge about that I did speak to about him. It had to do with his shoulder tightness in his pec and a little bit of tightness in the upper back. So through the FMS, I put him through the 7 tests. The results from the FMS was I noticed that he had a lack of pelvic and trunk stability. Now that one I noticed during the second test when he was stepping up and over the string. He was stepping up and over. There was a bit of a loss of his balance, so a little bit of lack of stability in through there. His pelvis rocked a little bit as well in the tightness in the hamstring stretch. So when he's bringing his leg up, there was a bit of that tightness there, meaning that there was a shift in through that pelvis. So the trunk stability is maybe a bit of that issue, as well as the tightness in the hamstrings and possible hip flexors. So those were all addressed in his program. That was the first things that I started to notice for. The other thing as well that I looked for in his shoulder mobility test was he got a 0 on it because he felt pain. So right away I knew there was an issue. Check to see where his range of motion went. He was very, very tight. So there's tightness in the pectorals and lack of range of motion in the shoulders. So right away, that just helps me start to think about what I'm going to do with his programming. With regards to the measurements, before I started, I obviously spoke to my client about his goals. I took his measurements. So I did a 9-point skin fold and circumference measurement at week 1, and I did it again at week 8. So that gave us some actual numbers that we could look at that he could see, because body composition was part of his goal. So those are the measurements that I used to start off with him. So starting into the periodization, I just told you there, my client background, 37-year-old male with substantial experience in Olympic lifting, as well as 15 years experience as a tactical athlete in special forces, military, and police. So I was working with somebody who had a really good, substantial base knowledge and ability as well. So with that came those few little issues with the range of motion with the shoulders through an injury that had happened, but is all something they can work with. So dealing with that, we went on to how I was going to periodize this whole programming. So the first 4 weeks, I went for linear progression, 1 week deload, and then 3 weeks of undulating periodization style. So I went with the linear progression. I wanted to keep it straightforward. So he works out about 5 to 6 days a week is what he was coming to me with. However, there was no real structure to his program. He was not finding anything. So in turn, that was kind of giving him issues when it came to his Olympic lifting, which is ideally what he wanted to start spending more time doing, was get into that Olympic lifting and maybe progress those. So what we did is we started out with the linear progression for that first 4 weeks, built that base starting at a 60% and then went up from there. The 1 week deload, nice and easy, and then 3 weeks I went into undulating. So I wanted to really challenge that body. So for the first 4 weeks, he knew what it was coming. So it was kind of base levels that we're just starting to set. The last 3 weeks, I wanted to kind of push it up a notch. So changing it. Some days he's going to be lifting at 70%, some days he's going to be at 90%. Different lifts, and then they're a little bit more, so they're asking more. So in a snatch, you're using a lot more energy than you would be for using something like just an overhead shoulder press. So the energy expenditures are different, and the body was never known. So it was kind of keeping it moving, started to increase that metabolic rate. The exercise selection and order, like I said, was base building strength, and addressing some of the asymmetries noted from the FMS. So in that first 4 weeks especially, I started to put in the exercises, the single leg RDLs, the single arm overhead press. So really focusing on some of the asymmetries I saw. So before you start asking someone to throw a barbell overhead, start to build out and use dumbbells, having them work out some of those asymmetries, getting that midline switched on and start to work on that as well. With that said, we did some mobility in through the shoulders and the pecs. So with the mobility, I also added in stability work as well. So if it's nice and loose, if I'm not strengthening and stabilizing it, it's going to be a higher risk of injury. So I did things like the bamboo overhead press and a bamboo bench press. So again, adding in that instability, much lighter weights, but starting to build that stability in through that joint as well. So next one here, I broke it down into weeks 1 through 4, that base building strength and stability using that linear progression. So I was working 3 sets of 15 to 60% starting out, 60-second recoveries, and then I built that up to 3 sets of 8 at 75% in week 4. The specific mobility and exercise that I was talking about for the shoulders and pecs are great. I've got a link here. It's a YouTube link here. It's Dr. Kelly Starrett. It is a great 5-way shoulder mobility exercise program that I had my client Nick doing. He had great results. His shoulders started to feel a lot looser, so it made everything else less painful. So that's a great link if you want to check that out. The shoulder stability exercise with the bamboo bar, overhead pressing using the light kettlebells starts to build that stability in a newly mobilized joint. In all of my training programs, I love compound movements. I do like my accessory work, but I love my big compound, big movers. So I did a lot of squats, deadlift, bench press, overhead presses. So those big, massive movers where he's nice and stable, and we're working on building that foundation. So the second mesocycle, I'm going to start kicking in a few of those Olympic lifts as well. So into week 5, I did a deload week. The workload was at 50%, and instead of having him do reps, I had him do it for time. So I had him go for 30 seconds at 50%. So the risk of him overtraining on a deload week like that are going to be really, really low. The whole point of that was to keep him moving, keeping those keeping that neuromuscular system firing as the skeletal muscles still firing, although they're still resting, recovering, getting ready for that second mesocycle. Again, those exercises stayed the same as they were in weeks 1 through 4, just lighter. So my program design in here was week 6 to 8 was that undulating program. So that's where I'm going. My intensity ranges go from 70% to 90%. And then my rep ranges go from anywhere from 2 up to 8. I stayed away from the 1 rep maxes. I kept it to 2s, 3s, and 4s a lot. Obviously, the higher percentage that we're working in, the lower reps. So we're starting to really push that strength. Again, he had 3 sessions per week. I progressed him from doing the normal back squat in week 1 into a front squat by week 6. So working on front squat, we're trying to transition to get more into those Olympic lifts. So thinking the likes of my next one here is the pull from the ground was a clean and a power snatch. So the first lift in a clean and a power snatch is a deadlift. And the first 4 to 5 weeks, he was doing deadlifts. And then he's also catching position on that clean is going to be a front squat. So I'm trying to keep those sort of movements working together, so they're kind of transitioning from one to the other. So once he's got the good base set up, I feel comfortable challenging him and giving him something else. My exercise order that I use is power, core, and then assistance. And then I also did that push-pull. That's a great way to improve the recruitment and recovery. So not taxing out one muscle too quick and then asking you to do something else. I use the push and the pull to get the most out of that. My midline stability was really important on this one. Midline stability was what he needed to focus on. So in every single session, I had him doing some midline stability work. So it was farmer carries, heavy farmer's carries, carries over his head, hollow rocks or hollow holds, planking, things like that, where it was more about the stability rather than doing your typical abdominal exercises, which were crunches and sit-ups, things like that. I wanted him to really work on stabilizing in through the whole torso for positions like when he's doing things overhead. He's got to brace overhead, keep that core nice and tight, as well as just all of his daily functional movements that he does is keeping that midline tight. So we focused a lot on that. Moving on to the next slide here is the exercises. I went through 2 exercises. So I did the one lower body, which we did a squat. So we had a few issues with that squat with a little bit of a narrow grip, and then the wrists need to be nice and neutral. So we corrected that here. You can see my client, as well as we did a push jerk. So push jerk was a little bit more of that dynamic overhead pressing movement. You can watch that video there and check out the 2 movements that we went through. The next one here is my application of the faith. When it comes to working with athletes and clients in my specific job role, what I've pulled from this course is actually looking at overall picture of somebody, looking at everything that they need from me. So my understanding of what their main goals are, what their ability to give to the program would be, and then me making it something that they can adhere to. So with my particular client, I had to think about exactly what his needs were, what his goals were, how I was going to get him there, looking at the whole picture of his health and fitness, and then working with him in a way that during training with people and exercise and kind of getting people to think about their wellness as a whole picture, is to look at their physical, their spiritual, and their mental health and wellness, and to try to encourage that, to respect their body, respect the body that God gave them. So challenge yourself, look after yourself, exercise and treat your body right, using strength. So sometimes building that physical strength, oftentimes that relates into people's work life or their personal life, that they find that they have strength. If you've had a really tough session in the gym and you've gotten through something, or you've achieved something by running a marathon, you somehow find that strength, and that kind of correlates through everything else in life. So that bit between the two is really important. The other thing that I like to put into my clients as well is a discipline. So discipline to get through what you need to do. So discipline to respect your body, discipline to go and eat right and to get into the gym. So those are the sorts of things that I kind of like to incorporate when I'm working with any sort of athlete or client, depending on no matter what their background is, to try to find that common ground of knowledge that I can kind of share that with them and hopefully get them the best that they can. Okay, guys, so that was my presentation. I hope you guys found that interesting, and thank you very much.